Experiential learning and clinical debriefing work in unison in assisting paramedics to provide exceptional and person-centred care. Experiential learning, as explained by McLeod 2017, is a process of learning with experience. This is relevant in the case of studying paramedics as well as qualified paramedics, where majority of knowledge is gained through experiences. These experiences should always be accompanied with reflection, thinking, and changes in future practice. The process of clinical debriefing is a tool that, as previously described, can work in unison with experiential learning to provide a guided reflection. This guided reflection can be used to discuss the scene, behaviours, and actions through a group conversation with honesty and open-ended questions. As highlighted by Kant and Cooper 2011, clinical debriefing has been observed to strengthen the skill set of health professionals and enhance the quality of patient care. In regards to experiential learning, there are various models that are used. The most widely used and known cycle is the Kolb cycle of learning. Within this reflection piece, the Kolb cycle will be referred to as the primary model of experiential learning. As shown in this picture, there are 4 basic components of this cycle: feeling, watching, thinking, and doing. These are the simplest terms to explain experiential learning. These terms can be further broken down in relation to paramedic practice. The process of feeling occurs when experiencing a situation for the first time. Within paramedic practice, no 2 jobs are the same. Therefore, obtaining and processing all information for every job is important. The next step in the Kolb cycle is watching. In regards to paramedic practice, this involves observing the scene and other paramedics, how they handle the situation in different aspects that are new to you, such as clinical reasoning and decision making, specific to the case. Thinking, as a step in the Kolb cycle, involves reflection, which is a vital skill in paramedic practice. Reflection on each case and new information acquired with reference to your feelings and understanding of the information is important to be able to enhance your skills, decision making, and further practice. The final step in the Kolb cycle is doing. This is the process of action based on what you have learned through experience and processed with reflection. Clinical debriefing, as described by Kessler, Chang and Mullen 2014, is a component of experiential learning that encompasses a guided reflection as a group. It is highlighted in this article that clinical debriefing is a military-derived procedure, as are many ambulance service procedures. Clinical debriefing in the healthcare and pre-hospital setting carries a high importance to discuss actions, behaviours, skills, and encourage reflection to improve future practice. Further discussed by Kessler, Chang and Mullen, clinical debriefs are generally facilitated as a group activity to promote group reflection and an honest atmosphere to improve teamwork throughout the health team. Experiential learning and clinical debriefing, I believe, have played a large role in my studies of paramedic science and my clinical placements with Queensland Ambulance Service. In my studies, I have learnt theory and clinical information relevant to working as a paramedic. Processing and utilising this information through simulation and assessment has assisted me to enhance my knowledge even further to apply it effectively in clinical placement. Throughout my clinical placements, I've subconsciously used the Kolb cycle for my experiential learning by observing, reflecting, and using information to enhance my practice as a paramedic. I have been fortunate throughout my placements to experience a wide variety of cases, both low and high acuity, that I believe have benefited myself. My experiences have allowed me to build confidence in my clinical knowledge base and clinical reasoning and decision-making skills. As a part of my experience on road with QAS, I have had many chances to experience clinical debriefing with a wide variety of people. With high acuity cases especially, it is influential to be a part of a large clinical debrief and to hear the views from different ranks of paramedics, such as clinical care paramedics and people from management roles. Being able to contribute to a job and debrief assists students such as myself to gain confidence in future practice. It was also great to see and understand that debriefing is not only to point out what needs to change, but what also went well in the case. My understanding of experiential learning with the involvement of clinical debriefing is that it is an incorporated style of learning within the studies of paramedics. This style of learning from experience is most beneficial in becoming an exceptional healthcare provider and providing high-quality, patient-centered care. In my experience, there is only so much one can learn in regards to theory in the healthcare field, and the majority of learning is done with experience and time. I have also found it important to learn from everybody you meet on road, whether it's other paramedics, patients, or other healthcare providers. Any information can be used in the process of experiential learning. In the case of clinical debriefing and reflection, I believe it is important to take every opportunity possible while you are still learning and to understand your observations with relation to your theory-based clinical knowledge. Throughout the development of paramedics as a university degree, many different styles of learning have been evaluated to decipher which would cater for the majority of health students and generate the highest level of healthcare providers. Kolb's cycle of experiential learning, as described by Williams, Brown, and Winship 2013, incorporates a higher level of growth and development among students than that of other healthcare models. The incorporation of theory, clinical simulation, and clinical placements being underpinned by the Kolb cycle of learning allows students to reflect on their practice in a variety of settings. This allows them to learn and enhance their practice for the future. The incorporation of clinical debriefing and reflection, as previously mentioned, enhances the confidence in students. The confidence gained from reflection and clinical debriefing will provide a higher quality of patient care and a better ability to build rapport with patients and other healthcare professionals. Kessler, Cheng, and Mulan 2014 suggests that clinical debriefing is to assess positives and negatives of a case as a team performance to enhance the process and outcomes for future practice. In conclusion, the style of experiential learning with the Kolb cycle has proven beneficial for my practice as a student paramedic. This style of learning has taught me the essential skill of reflective practice and how to learn from my reflection. The ability to reflect on a case and relate to clinical theory has allowed me to develop a higher level of clinical skills and the ability to use clinical reasoning and decision making to improve patient outcomes. With the use of reflection and literature, I now have a better understanding of the Kolb cycle and clinical debriefing, as well as how it has benefited myself through the past 4 years of university study. I believe that in my future practice, I will continue using experiential learning to benefit patient outcomes in my learning as a paramedic.